Hello friends, in this next video from Med site, we're going to tell you about how to prepare for surgery for various competitive exams like AIMS and PGI. Especially in AIMS, surgery per se is a very high yielding subject because only a very few selected topics are tested, but they are tested in depth, so you should know everything about them. So here are a list of very important 4 topics that you should really focus on, and the fifth one, in coming recent years, a lot of images have been coming, so you should also know about instruments as well as minor procedures in surgery. For those of you who are just uh, preparing for the first time or as have just started their final year or internship, you should actually read a theory book, especially for breast and thyroid, and be well versed with everything starting from screening, diagnosing, and treatment of breast and thyroid diseases, both benign as well as malignant. Also, you should be familiar with the latest ATLS guidelines on approaching trauma, and you should also know about burns, types of burns, and their management. So here's a slide showing the bariatric categorization in breast diseases. So you should be familiar with what are the various bariatric score. They could give you a mammographic picture or could just tell you the score in the question stem and ask you the next step. And you should know what each bariatric category means and what is the next step, that is whether to follow up or to do a biopsy, what to do next. Since a lot of images are coming, so you should also know how a core biopsy needle looks like. You should know about the indications for core biopsy in breast diseases. You should also look up on the net how an FNAC needle looks like and what are the indications for FNAC, what to do when a core biopsy is inconclusive. So likewise, I'm telling you should know each and everything, especially for breast cancer as well as benign breast diseases like breast cyst. And you should, while preparing for breast diseases, you should uh, learn that in a flowchart manner, like what will be the next step, like you should prepare an approach to a lump, an approach to a nipple discharge. You should have a flowchart ready so that if they ask you in the question chat what is the next step, you should be well versed with it. So here's a few images showing thyroid scan. You should know how normal thyroid scan looks like and how it looks like in various pathologies. For example, in Graves' disease, there is a diffuse uptake of the radioactive isotope. In thyroiditis, there is decreased uptake diffusely in the thyroid. Also in MNG and toxic adenoma, you should be able to differentiate both of them. Where in toxic adenoma there is a single foci, and in toxic multinodal goiter there are multiple foci of increased uptake. In thyroid, you should also know in a flowchart manner and on an approach to a solitary thyroid nodule, what are the indications for surgery in solitary thyroid nodule. Should also know a little bit about management of thyroid cancer, each and every type. In the last few years, a lot of questions have also come from C-spine and trauma. So you should be familiar with 2 rules of cervical spine management in trauma cases. One is the Canadian safe spine rule. Another is the nexus criteria for indications for imaging in C-spine injury. Always remember that in C-spine injury, C-spine stabilization comes first as part of the primary survey along with airway control, whereas imaging comes in the secondary survey after stabilization. Let's go through this slide and have a look. You should also know about the various zones of neck injury. So zone 1 is divided from the clavicle to the cricoid cartilage, sorry. Zone 2 is from cricoid cartilage to the angle of mandible, and Zone 3 is from angle of mandible to skull base. You know that Zone 2 injury are easy to deal with because they're easily accessible surgically, whereas Zone 1 and Zone 3 are difficult to access surgically, and also because they're complicated by the vicinity of critical neurovascular structures that are there. So I was telling about like the fifth most important thing in surgery are the instruments and the procedure, and one very important procedure is ICD insertion. So you should know about how an ICD tube looks like, what are what is the site for inserting the ICD, what are the indications for inserting an chest tube, and what are the complications. So the most common site of insertion is the triangle of safety. You should know the boundaries of that triangle, as laterally it is bounded by the latissimus dorsi, medially by the pectoralis major, and inferiorly by the fifth rib. In burns, you should know how to calculate burn surface area. You should know the difference between pediatric as well as adult age group. Know the formula that is used for burn surface area calculation, that is the Parkland's formula. You should know the fluid of resuscitation in burns and the amount of fluid to be given in what time by the Parkland's formula. The fluid of resuscitation being Ringer's lactate. And you should be also familiar with the common burns chart that are used bedside. Most commonly clinically used one is the London Brown chart. A question has come up on that also. In neoplasm, the most important, as I've already focused on, is breast, thyroid, colorectal, and gallbladder cancer. Few questions have also come upon from these topics like anal canal cancer, testicular cancer, and esophageal cancer. So you also know a little bit about them, their prognosis, what are the treatment modalities available, and the indications for each surgical procedure. For any doubt in cancer management, you should look up on this site, the National Comprehensive Cancer Network. The NCCN guidelines are the standardized material that are available, and you could make your free account on this website and get yourself the latest guidelines available. Always refer to these guidelines. In GI surgery, important topics are portal hypertension, management of variceal bleeding, approach to a GI bleed in general, both upper GI bleed and lower GI bleed. What are the investigations they do? Similarly, in this also have a flow chart ready. What you're going to do in a stepwise manner. And what are the treatment modalities available? Should know about surgical obstructive jaundice, the differential diagnosis, and how you'll approach this case. This approach is also very important. In transplant surgery, you should mainly focus upon liver and kidney transplant. You should know what are the indications for liver and kidney transplant, what are the different types of rejection that can occur in these, and the complications, both acute and late stage complications. In bariatric surgery, you should know the indications for bariatric surgery, like the age criteria, the BMI criteria, and also remember that medical management comes first in bariatric surgery before proceeding for surgery. In this, only two things are very important. You should know sleeve gastrectomy and Roux-en-Y gastric bypass. Be familiar with the schematic diagram. Be familiar with what are the complications of each procedure and what all metabolic benefits you get after surgery. This is a very important topic, approach to an acute abdomen. You should know the differential diagnosis of acute abdomen and how to approach in a flowchart manner of acute abdomen, and especially should focus mainly upon acute cholecystitis, acute pancreatitis, acute diverticulitis, and perforation. How to diagnose all of these and what is the management of each and every one. Few questions have also been asked on the barium meal findings of these pathologies. So you should be able to differentiate how achalasia cardia looks like on a barium meal, that is the typical bird beak appearance, versus esophageal cancer, which shows a ragged end appearance on barium meal. They could also give you a chest X-ray picture showing loops of bowel in the chest, signifying a diaphragmatic defect. You should also be familiar with the barium meal finding in Zenker's diverticulum and in Nutcracker syndrome. They could also give you images on volvulus, especially have a look on sigmoid volvulus imaging. It could be quite confusing. The typical apple core lesion and colon cancer on barium enema, and the air fluid levels, intestinal obstruction. Also be very well versed with the management of intestinal obstruction. The airline is meant to do a conservative management, and what are the indications for emergent surgical intervention. Also know about how a diverticulosis looks in a colonoscopic picture and the typical comb silent Crohn's disease and lead pipe colon in ulcerative colitis. So though, as I said, they could give you an ultrasound finding of gallbladder showing posterior acoustic shadow, know how to differentiate a gallbladder polyp from a stone. They could very well check you on that. This slide shows the hepatic quinine segments. In this, what you should know is what is anatomical lobes of the liver and what are the functional lobes of the liver. The anatomical lobes are divided based on the attachment of the falciform ligament, whereas the functional lobes, which are more important, is based on hepatic venous anatomy. And the functional right and left liver lobes are divided based on Cantley's line, which is an imaginary line passing through the middle hepatic vein through the gallbladder fossa. So approximately this would be the right lobe of the liver and this would be the left lobe of the liver functionally. So here are a few images showing the barium enema in various esophageal motility disorders. You should know, like this particular image is of achalasia cardia showing the typical bird beak appearance. You should be able to differentiate this from barium meal imaging in carcinoma esophagus, where this end would not be as smooth as in achalasia. This particular image is of diffuse esophageal spasm showing the characteristic corkscrew esophagus. Similarly, you should also be familiar with all barium enema findings also in colon cancer and diverticulosis. So this image shows the characteristic apple core lesion in colon cancer. This is an image of intussusception showing the telescoping of bowel into it. And this particular image is of diverticulitis showing inflammation around the sigmoid colon with the passage of the contrast is narrowed because the intestine here is thickened, the intestinal wall is thickened. Next, this slide showing various incisions that are commonly used for various surgery. You should be well versed with this, especially the incisions for appendix, the McBurney, Lance, and Rutherford Morrison. And you should know at least 2 or 3 surgeries that are done with these incisions. In urology section, you should focus mainly on kidney stones and stones and at other sites in urinary tract. You should know about the types of stones, their urine analysis findings, what is the management of stones at each and every site, the conservative as well as surgical management, what are the indications for surgery at each site, and what are modalities that are used for stones like ECWL, extracorporeal shockwave lithotripsy, or PCNL, when to do a PCNL, and when to do open surgery. You should know the indications for each. Some questions are also asked on congenital anomalies of the urinary tract, like the duplex ureter or the retrocable ureter. They could give you imaging findings of these pathologies, and you should be able to recognize them. You could also get an IVP intravenous pyelogram of a kid having a PUJ obstruction, or in MCU finding in vesicoureteral reflux. Some questions have also come on CT finding in emphysema of pyelonephritis, and other important topic is renal cancer. You should know the various, at least the benign and the malignant types of renal cancer, and what are the surgical approaches for that. When do we do a partial nephrectomy, and when we do a radical one. And also read a little bit about immunotherapy in renal cancer and the side effects of the drugs that are used for immunotherapy in renal cancer. So here's the IVP picture showing the cobra head sign in ureter seal. This one is a congenital duplex ureter, also with a little bit of and what looks like a horseshoe-shaped kidney with double ureter. This image is showing the right ureter, which is obstructed at the level of IVC. See, this loop of ureter is coming back, and just at this is the site of obstruction with hydronephrosis and dilatation of the ureter. You should also know about TURP. In prostate, only two things are important. One is BPH and another is prostate cancer. And you should read these topics very well. In peds surgery, important topics are cleft lip and cleft palate. And you should know about the timing of surgery for these pathologies. And Hirschsprung disease, you should know both about the presentation in children and how they present at what age, what is the investigation of choice, and what is the management. Also, you should know the imaging finding in that. You have congenital megacolon. In vascular surgery, read about the grafts, the various types of venous grafts, sites of harvesting those grafts, and also know about varicose vein, imaging finding, and the management. What is the conservative management, and what all surgical approaches that can be done, like venous stripping or radiofrequency ablation, etc. In plastic surgery, read about skin grafts and various types of flaps used. And for reconstruction, I think the most important is breast reconstruction. So you should have a knowledge about breast reconstruction, especially, if not everything else. Next, I told you in the beginning, apart from those four topics, this one is frequently asked in AIMS, especially with image-based questions. So you should know the commonly used equipments and instruments used in surgery. Here a list we have put that are commonly used and could be asked. For example, this is an image showing an hemostatic artery forceps. You should be able to differentiate it from a needle holder. Look carefully at the jaws, the stem of the instrument in order to differentiate them. For example, this one is a Babcock's forceps, and this is a Alice forceps with toothed end.
So for each instrument, also know at least 2 to 3 uses for each instrument and what structures can be held with these particular instruments. This image showing discharging colidocal forceps that is used for removing stones, can be used for removing CBD stones or removing stones from kidney or bladder. Also have a knowledge about the various types of retractors used. Be very well thorough with the imagings of each one, like Devers, Morris, Richardson, Langenbach, Catspaw. These are particularly important. Know about the monopolar cautery and also the bipolar cautery, the principle. Look at the image of Vieri's needle and the what are the gases used for creating pneumoperitoneum. Laparoscopic ports, images of those. Jawl's thyroid retractor, vascular clamps, Satinsky, and bulldog clamps. There's just a short list that are commonly used, and you should look up on the net of all these images. For example, this is an image showing Devers retractor. They could also ask you, but just showing that image, out of these options, which structures can it be used for retracting? So the image showing a Morris retractor. This is an image showing Jawl's thyroid retractor used in thyroid surgeries. Also, you should be able to differentiate between Mayo's and Metzenbaum's scissors. What all structures can you cut with both scissors? Intestinal clamps, both stomach as well as small intestine. Differentiation between bone cutter and a bone nibbler. Periosteum elevator, giggly saw, Humvee knife. This is a Humvee knife used for harvesting skin grafts. This is one of the laparoscopic instruments, and this is Vieri's needle. They could also ask you about various drains and catheters. I'm sure you must be knowing this Foley catheter. This is a Malacca drain, and know at least 2 or 3 uses of each one. So here's the Metzenbaum and Mayo Caesar. This is for tough tissue, and this is for delicate tissue. So out of procedures, important ones are lumbar puncture, taking out an ABG, that could also be asked, the principle involved, insertion of a central line, tracheostomy, and I would suggest read these procedures from a standard textbook, because it would also help you in your clinical practice. And in recent years, detailed questions have come on the principle involved of these procedures, and also bone marrow also. So you should read these from standard textbooks. This is an image showing just a proctoscope used while doing a digital rectal exam and having a look at the rectal canal. This is an image of a central line. You should know the indications, the complications of each and every procedure, and what are the uses. Know the ports, 3 different types of ports, what all we give through each and every port. And this is a diagram of an ICD. You should also know about ICD insertion. You should be able to recognize the tube, what site it is inserted. They could also give you an image of an underwater seal bag that is used. This is an image of a pigtail catheter that radiologists frequently use. Another important image that comes is on sutures. You should know the various types of sutures, the uses of each and every type. You should be able to recognize them. So, what color is it, and what properties that each and every suture has, like whether it's a monofilament or a polyfilament, what advantages, what is it, half-life, what is natural, what is synthetic, whether it is absorbable or non-absorbable, etc. At last, we would like to thank you for watching this video, and we hope that this will help you in some way in your preparation. And remember that the expert in anything was once a beginner, so all of you stop thinking about it, you just have to start.